we're going to go over therapeutic groups. And as we all know, as a group, we all work together, and it's where individuals can come together with a common purpose and get some kind of mutual benefit by giving and receiving information and feedback within that group, and it usually has some kind of unique context to it, depending on the group and the type of group work you're doing and who you're meeting with. Now we're going to have characteristics that influence a group, and they do have some different types of groups that are on page 608, box 33-1, and these are some of your therapeutic groups. Your groups are going to have different sizes, and a group must have at least 2 or more people. The other thing that we're going to see is that they have a defined purpose, meaning they have a common goal or an interest. And then they're going to have members, and these members are those groups that are in that box 33-1. Then they're going to have the content. They're going to have rules. When are we meeting? What is the purpose of our meeting? When do we end? Where do we meet? How long are the meetings, and so forth. They'll have boundaries as well, saying that this is the context of what's going to happen within these group meetings, and you're not going to pull other things in from around there, from outside that context. The content is usually what is said in the group. It's the theme. And then you're going to have your process, and this is your underlying dynamics among the group members. And then you're also, in the end, you're going to have some type of feedback and any type of conflict, and how to take care of those conflicting situations as well. And what are we going to do if there is a conflict? So you'll also be putting up rules for those along with your other rules for your meetings and for your group's project. These next 2 slides go over factors that are common for all groups. And this is, first of all, we want to instill hope. This is where they have support. And they're going to have everyone share some type of optimism and how to improve things. Universality, excuse me. This is where you realize that they are not the only ones with this issue when they're meeting in these therapeutic groups, that there are others, that they're not the only ones that have these feelings or the thoughts or any type of problems that they have. Imparting information, this is where they're going to get this teaching from, their peers, the person leading the group, and so forth. Your altruism, this is where they're going to get something from giving support to others, and this is actually going to help them to improve their own self-worth, self-value. When you have corrective recapitulation of primary family group, this is where members repeat patterns of behavior in other areas that they have learned in their own home environment or from their families. And so the leader should give them some type of feedback, as well as their peers, where they can actually start learning their own behaviors and quit repeating what they've seen in the home or what they've been raised with. Then we have your development of socializing techniques, and this is where people learn new skills, new social skills, by either modeling or from others' feedback. Imitative behavior, again, this is copying behaviors that they're learning, and learn how to adapt or how to adopt better habits than what they were using before. Your group cohesiveness, or this interpersonal learning, this is where they start to gain some insight for themselves by speaking with others, by getting the feedback from the group. And this kind of happens later on, where they actually start to reflect and think, they're right, or I've picked up on this, I've learned this way to behave or to interact or to communicate or to react in a situation. The group cohesiveness is, this is when the group has really been blended and they're moving well and they begin to connect. There's a connection. They have a strong group. they may even have a leader in that group, but they work as a whole, and they accept each other, they give each other positive feedback, and they can actually give each other constructive criticism without someone getting angry or hurt. Catharsis, this is when they start to experience and express their feelings, because they're becoming at the end of their sessions, and they're starting to really share, and especially on an emotional level. And then at the end, you have your existential resolution, and this is where they begin to start to examine parts of their own life that affect everyone else, and besides themselves, but it also has effect on the others in the group as well. I'm hoping you'll remember some of this information, and these are phases of group development. And the orientation part, this is where you're starting to, you're meeting for the first time, you're setting the boundaries, you're getting to know each other, setting your ground rules, starting to meet each other, and getting to know one another, and kind of just setting everything up, and getting to know one another's, and structuring each person's role. In the working phase, this is where the leader is going to start to step forward and encourage everyone to focus on problem solving, making sure everyone's consistent about the purpose of the group. They want to make everyone feel safe, secure. They should have a positive outcome. There should be some kind of guidance to, if there's conflicts, how to resolve those. Everyone should be able to feel confident and empowered during this phase and support one another so they can work together. Termination is at the end, where they start to reflect on the progress and identify, they're meeting the determined goals to terminate the group. And sometimes there are feelings of loss, sometimes there's anger because they've become so supportive, and it's really hard for them to break off now from this tight group that they have formed. There's also group member roles. The task role, this is the one that keeps the group focused and focused on the task at hand. Your maintenance role is really that glue that keeps the group together, keeps them going, keep them, moving forward, and trying to meet the goals during this, this last phase that they're going to. And then individual roles really have nothing to do with helping the group, but instead it's more about the persons themselves, their personalities, what is their own agenda that they're going to be working on, what desires do they have that they want to meet during this time that they are together as a group. And you can look at some of these on page 609 and 610 in your textbook. When you think about the leadership responsibilities, the group leader is going to be the one that's going to be initiating, maintaining, and terminating the group. So they have to kind of command attention. They have to make sure they structure everything, make sure it's the appropriate size, know what the purpose is of the meetings, make sure that the time is defined so everyone knows that this is our meeting time. Your task or your maintenance functions are going to be during this the working phase, and this is where they're going to facilitate a lot of communication to kind of get the group moving along, and then they'll also be setting up the termination where they can ensure that each member looks at their accomplishments and have some insights about where the meeting is going, how the members are doing, and give positive and negative feedback regarding the experience that the group members are having. And just like we do in business and in management, we also have leadership styles. So you may have a leader who's autocratic, who has, a lot of control over the group. They don't encourage any kind of interaction among others. They kind of stand there and tell them, this is it, this is how it's going to be done. Your Democrat leaders, they're going to be the ones who has extensive support by the members of the team. They're going to use them in problem solving and get their input, and they kind of empower everyone. The laissez-faire allows the group members just to choose whatever way they want to behave, and doesn't even attempt to try to control what direction the group's going in. They just kind of let them go. It's kind of your creative type of leadership. Let's just see what happens. On page 612, table 33-4, they talk about some of the theoretical foundations for group therapy, so the concepts and the role of the therapist in each type of theory or group settings, your cognitive behavioral, your existential groups, communication, interpersonal, psychodynamic, or psychoanalytic type of group therapies. The other thing that you'll notice is that the basic level nurse, she's going to have psychoeducational groups, and they're going to set up information about the knowledge and skills about different types of psychological subjects, and they're going to allow the members to talk about what are their concerns and their worries. Sometimes they do have a limited time, or may be even limited in their support, but we want to look at their long-term treatment. So they're going to have written handouts, audio visuals, and they're going to have certain teaching points that they want to make sure that the individuals know about whatever psychological issue that they're in there for that group, and give them that information, all that background information that they are going to need about it. They're also going to conduct medical education about the medications, what to look out for, ask them any questions, help them to manage their medications, how to take it, any concerns they may have about it, and helping them to learn how to self-manage themselves, because they've always had someone helping them do that, and then when they get out on their own, they've got to do it on their own. On health education groups, this is another thing that the basic level nurse is going to be helping with, and this is actually, again, looking at the medical condition and talking about some of the topics, because a lot of times they still have comorbidities. Not only do they have the psychological issue, but they have these other things going on too, so they have to have that extra information. Let's see, dual diagnosis. Again, sometimes we have two coexisting medical illnesses, and a perfect example is someone having some kind of psychological issue, but they also have a substance abuse disorder as well. So we're having to use both of those and educate, and trying to make sure that that we're knowledgeable about both the mental health and the chemical dependency that they may have, and about treatments and how this can affect that patient. Some more information is that they also do look at symptom management, looking at symptoms of disorders and how can they manage those, looking at again, your coping mechanisms, what is their of course, their primary goals, and helping them set those up. Of course, one of their goals is to increase self-control by helping them to develop a plan of action, so they don't end up back into the healthcare setting or having the relapse. The other one is stress management. Lots of times it's fast and furious. We're trying to help them get back out, but we forget that they're under a lot of stress, and so we need to teach them about relaxation techniques, because they are stressed that they are going to have a relapse, or what am I going to do out here on my own. So again, helping them to look into their emotions, look for any kind of physical symptoms that they may be having in response to the stress that they may be having. Let's see. Therapeutic community meeting groups, again, just telling them where they can go for group meetings, for peers, peer groups, support groups. Again, where can they meet? And this is those last two, well, I don't have bullets there, but those last two bullets. Where can they go? Where can they learn to, get out and, out into the world and start working as a functioning member of society, but also when they need help, who can they turn to? Where can they go for support? What are those resources? So definitely you need to be a part of that as well. One thing, sorry about that. One thing that can happen is sometimes you can have members of in a group that can be very challenging. So someone may be the monopolizer. They're trying to monopolize the whole meeting. Everything's about them, and so everyone else gets a little. No one gets a chance to speak, be heard. Some people just tune everything out. It's like, oh, here we go again. It's all about them and their problems, and they don't give anybody else a chance. So that's that person monopolizing. So we have to make sure we don't let one person monopolize. The other one is the complaining member who rejects help. And so they love, sometimes people just like to complain, just to be complaining, but they don't want help, and they bring all these problems in and actually brings down the whole group. And again, that negativism can actually spread. So again, we have to look at that. And sometimes people, that's their thing. They get off on that, and they're like, yeah, here's my problems. This is what's going on. Oh no, I don't need help. I can do this on my own. But they're very self-centered, and continually they're going to reject help from others. Demoralizing members, these people are very self-centered. They're angry, depressed. They really lack any kind of empathy for anybody else. They're just hopeless kind of people, so they're going to challenge the group leader. They're going to be very negative about anyone's comments. They don't want to listen to anybody else. This is when you need to pull them aside and speak to them. Say, you're not going to be able to be a member of the group if you don't let everyone contribute. You're bringing everyone down. You're very negative, because they can cause everyone to be angry. So that the leader needs to try to keep the members positive and reduce any hostility or negativity that can come to the group from this type of member. The silent member is the last one, and this is one who observes everything until they decide it's safe to speak up. So they don't believe, sometimes they don't have a lot of confidence in themselves, and sometimes they take a back seat if you have that more assertive member. But just because they're silent doesn't mean they're not engaged or involved. There's just some people who will just sit back and take everything in. So they may not speak up a lot. So we have to watch those individuals, because are they engaged or are they not engaged? And because, sometimes we need to encourage them to engage, because they might have some really insightful information that they can share with the group. Okay, that's all I have for therapeutic groups.